So, onto a continuation of the interaction I had with a new client and the questions she had asked me. And, actually, I had a personal experience recently with this particular concern in patient interaction. And this is the provider or physician's ability to really listen to the patient and hear what they have to say. I recently had to go in for a pretty common procedure, and I had shared with the physician that I was very concerned about anesthesia because the last time that I had had this procedure done, I had difficulty waking up from the anesthesia, and that was the piece of it that had really scared me. The physician responded very kindly to that, talked about the type of anesthesia they would be using, and really calmed my fears. But then going through the questions, the physician asked, "So have you ever had this procedure done before?" And as a patient, I thought, gosh, did he listen to anything I had to say about my fear about the anesthesia, or are we just going through the rote questions you ask every patient? So listening is probably one of the most important things to improve your patient satisfaction. And the way that you can listen better is to paraphrase back what the patient said to you. You certainly don't want to repeat everything word for word, make it very repetitive. It would sound disingenuous. But you certainly want to acknowledge the patient. And when you go to a question that's on your list of questions, remember that the patient already gave you the answer to that question, and it's an opportunity for you to reassure them again. Listening when you're on a very busy day and a very hectic day seems to be the thing that falls by the wayside for a lot of physicians and providers. They just have to get through it in a very brief often 10-minute office visit. I understand that challenge for physicians, that time and that productivity element of it. However, you can listen and not add a lot of time, actually decrease your time and increase your knowledge of the particular patient because they have the answer. If you just listen to them, they will tell you their diagnosis. Let them talk in the beginning, as I had mentioned before, the electronic health record video. Let them talk that first 20 seconds or so and let them tell their story. Repeat back to them the things that you heard and then ask permission to enter it into the electronic health record. But if you comment on what they've told you, if you repeat back what they told you, they'll know that they're unique and special and that they were heard. This is so important to build that relationship and for them to know that they're just not another patient in a series of patients that you don't care about. Because as we all know, whether in a professional life or a personal life, when someone doesn't listen to you, you feel uncared for. Listening is a critical aspect of it. I have some assessments that I use with physicians that really struggle with this, and I can do some interventions based on the particular area they're struggling with. If you want more information about this, please contact me. You know how to reach me, melissastewart101@gmail.com. Reach me. My information is below as well, and I will happily reach out to you and help you in every way I can to help that patient experience score increase, no matter what the issue is. I will continue this with my next video. Again, a continuation of the questions that particular client asked me, and I hope these are helpful to you. Please let me know. Thanks again. Bye now.